What's up, my podcast listeners? This is your host, Rafal Matuszewski, and I'm excited about this episode because it's going to be a compilation one. As I was going through all my old episodes, and I realized that I've done 3 separate episodes on knee pain, and since knee pain is quite common for a lot of people, even for myself, over the years I've experienced knee flare-ups because of stupid shit that I've done. I think it's going to be valuable to bring these 3 episodes all together to have kind of like what I've been doing, the ultimate guide to knee pain in this case. So 3 of these episodes, one of them we go over kind of like the pain mechanisms of knee pain, the anatomy of knee pain, and what things can influence the knee going into ranges that may not be, the best for you. And I think it's really important to understand this to preventing knee pain, because a lot of us just kind of go, willy-nilly in the gym, and we kind of just hope for the best when it comes to... Sorry, my camera is just fucking terrible right now. And we just kind of hope for the best when it comes to training in the gym, if we're hiking, whatever it is. And we kind of investigate what influences the knee, aka the hip and ankle, when it comes to anything, physical, like exercise or, running, walking, hiking, those sorts of things. And then in another episode, we go over what are the typical injuries that we see with the knee, how most knee injuries happen, and then we also go over exercises to do if you have knee pain, because that's one of the things is like, you could be training and, everything is going in the right direction for you. You're seeing progression, you're being consistent, and then out of nowhere, you're like, fuck, my knee that had an ACL reconstruction, 2 years ago is kind of getting, is kind of getting flared up again, and I don't know what to do in the gym because every leg exercise hurts. So this is where my experience training clients for the last 12 years, figuring out what exercises are knee friendly. So if you do experience a flare up or, out of nowhere your knee hurts so bad that you can't even kneel on it, what you can do in the gym instead. And sure, you can go down the path of like, I'm just going to do upper body for the next 3 weeks before it, settles down. But to be honest, your upper body can only take so much volume before you're like, fuck, I need to, stop this. And, your shoulders are sore and everything like that. So we go over the typical exercises I give clients when they're dealing with stuff like that. And I think this whole episode all put together is going to be a very useful tool and kind of guideline. And hopefully I answer all the questions, because I was writing down all the common things that I see with clients, patients in the clinic dealing with knee pain who are, inactive or active, and just giving them all the solutions they can have to ensure that, they can get back to their normal. Because when you hurt your knee or you have a flare-up, you learn that your knee influences a lot of movement, and it's kind of hard to come back from that. And hopefully this kind of sheds some light. And I'm excited to bring this together. So without further ado, here is the knee compilation episode. Everything you need to know about the knee, the ultimate guide. Here we go. Onwards and upwards, as they say. What we're going to talk about today is knee pain, because honestly, I think as much as everyone would like to think that, they've done a good job trying to stay pain-free, we've all kind of experienced either some serious knee pain or just some knee pain that is annoying, and you've had to modify a lot of exercises and things like that. And I want to get into kind of the anatomy of it, why it matters, common reasons why people get knee pain, and kind of wrap it all up with some suggestions and some exercise prescription and things like that. And I think probably the biggest thing when it comes to knee pain is figuring out why, because most likely it's going to happen again. And I think a lot of us who've gone to either a physio, chiro, massage, whatever it is, a lot of times when it comes to knee pain, they tend to treat just the knee itself. And again, like, that's a good thing to do to kind of lower inflammation and, like, you know, the quality of the pain, so then when you leave the clinic you can actually walk and not feel completely destroyed. But there's usually an underlying issue that's got to look on the bigger picture. So in my industry, or I don't even know where I stole this saying from, but the knee joint is considered the stupid joint because it's usually dictated by the hip and the ankle. So usually when I see a patient or I have a client dealing with knee pain, right away I'm looking at how the hip and ankle move and the surrounding musculature, and then I also look at the knee itself because the knee needs to be able to move, and I'll kind of explain why. So this is where the laptop is going to come super in handy, because again, I'm a huge visual learner, and when it comes to anatomy, me just saying, you know, muscles doesn't really help anyone. And I feel like a lot of times when people are at what's it called, conferences or whatever, and people say out a muscle name, and everyone's supposed to know what that is. But just like last time, I'm really hoping that you guys will be able to see this. So this guy right here, well, you can see the ring light. Oh, there you go. That looks better. So this is the sartorius muscle. So if you can see, I'm trying to get the ring out of there. Ooh, my laptop is super dirty. But you can see how the red line is kind of focused on where the muscle is. You can kind of see where it attaches from the hip to the knee. And the interesting thing about the sartorius, or the next muscles I'm going to be kind of talking about, is that the fact that they cross two joints. So it already shows how much influence now that this hip that may not be working the way it should is influencing the knee. So we already have one muscle that we're going to be talking about, and some other ones down the line, about how it influences our movement, right? So if you think about one giant muscle literally running from your hip all the way down to your knee, we already have kind of a clue of where to go. So now I'm thinking, okay, what other, you know, muscle out there in the hip / knee region would be also connected? So let's pull up the quadricep muscle. So again, stupid ring light. So the green, you can see how it's connected to our pelvis, and then it goes all the way down to the knee. Another great example. And I think for most of us, you know, sitting at a desk all day, we can assume that those quads are quite tight. And if you are like anyone else out in the world, foam rolling, and you get to your quads, I think all of us go, oh shit, that's tight, ooh, that doesn't feel good. And then you wonder why a lot of people end up having knee pain. The other one that I want to bring up as well is the muscle called the gracilis. So if you, again, you can see past my damn ring light. Pelvis, inside of the pelvis is basically an adductor. It goes across, again, inside towards the knee. So I've already brought up a bunch, well, 3 muscles so far, how they're connected to the knee. So now imagine those 3 muscles are not functioning the way they should. They might have some tightness, and that's in air quotes, and that's going to influence how the knee moves. So for example, if I know that my quads are super tight and I'm trying to do an exercise like a reverse lunge. And I actually want to demo that. So I'm going to move this guy and hopefully I don't mess anything up. So actually I'm going to make this go a little bit lower. Thank you for bearing with me. So we are looking at my right leg. If I know that my quad goes from the hip down over towards my knee, and I know that these guys are super tight because I'm in this position all day, and I go into a reverse lunge and all of this is now being stretched, and I go down into that reverse lunge, I'm going to start feeling that tightness going all the way down from my hip down towards my knee. So if I allow my muscle to, again, air quotes, stay tight, things like reverse lunges, jogging, running, like anything that requires you to do hip extension is probably not going to be the best feeling, and that knee is going to kind of take on a lot of that pressure. Now, if we think about the sartorius that goes from the hip across and then down into the inside of the knee, and we're also thinking about the gracilis that goes from the inside of our pelvis down into the inside of our knee, and we're trying to do, let's say, lateral lunges, lateral split squats, we're trying to play soccer, and all these guys are tight, and that allows our knee to flex and extend because it goes across this way. And this is one of the reasons why in my kin stretch class I do a lot of adductor work, because people just have no control over it. So actually a simple exercise that I tend to give a lot in my kin stretch classes for this specific reason, and I'm going to try to get this nice and low so you guys can see. So if I was in my 90-90 position with my left leg in front, really simply all I get people to do in my kin stretch class is to demonstrate their active range when it comes to one, hip flexion, and adductor strength, actively lifting it up off the ground. So essentially all I tell people to do is to think of getting their left ankle, in this case, to lift off the ground and hold. And isometrically hold it without like leaning back, caving in, or anything like that, to get these guys stronger. And as we get this guy moving and grooving a little bit better, adding knee extension and flexion, because again, like the thing like the sartorius, the gracilis, they're all on the inside that cover our knee. Also our quad, again, goes from our hip down over onto our knee. So when it comes to the relation of these muscles that cover two joints, it's probably quite important to also demonstrate not only what they can singularly do just at the knee, but also at the hip. So in this case, I'm adding hip flexion. And now if I wanted to challenge those three muscles, is also adding some knee extension and flexion to really focus on getting all those muscles actively moving through both joints. And anytime I throw this exercise or any other kind of variation utilizing those adductors and hip flexors that cross both joints, people have a really tough time with them. So now that kind of gets my brain kind of thinking like, okay, if people are having trouble with that, just lifting their own leg off the ground, when it comes to running, playing soccer, doing lunges, step-ups, back squats, deadlifts in the gym, something is going to have to give. And a lot of times it's the knee is going to take up the grunt of the work, and over time it's kind of like the straw that breaks the camel's back, and now I have soreness around the knee, and it might be most likely due to the hip. So other than the muscles that I've just kind of spoke about, there's other ones surrounding the knee that will influence how much movement you get. And it's usually all the muscles in your hip that focus on hip flexion. So hip flexion, again, if you don't remember from previous videos, is when I drive my leg up towards the ceiling, I'm doing hip flexion. So if you think about what we do on a daily basis and sit all day, all those hip flexors are going to end up getting quite tight. And when we have those hip flexors quite tight, it's going to influence how the pelvis moves, right? So if I'm trying to do any exercise that requires my lower body, and if I don't have adequate hip mobility, again, the knee kind of takes the grunt of the work, and it kind of sucks. So if you think about when I demonstrated hip cars, it kind of goes through all the ranges that a healthy hip can do. So if you look here, how I coach hip cars, I also add adduction right off the bat. So kind of similar to what we did here with the 90-90, as I'm driving my leg up, I'm going into adduction and external rotation, coming out of it, rotating around and behind. So in a healthy hip, all these ranges should be available with any kind of compensation. So when I do hip cars, you don't see anything else in my body move other than my hip. So going back and forth, I'm demonstrating what a healthy hip can do. So now imagine, the average Joe, where they sit all day and those ranges are not available to them. Again, the knee kind of takes the brunt of the work, or worse, also the low back. So usually if you find yourself in that pain category where you're trying to move and feel better, you usually have I would classify 3 things, but the most common ones are low back pain and knee pain, and then the third one usually is like shoulder pain, all due to what's happening at the hip, right? And if you think about it too, it's like the hip is designed to be a super mobile joint. The low back is supposed to be designed as a stable joint, and the knee as well is supposed to be designed as a stable joint. So if you have one joint in the middle between those, it's almost like a sandwich. That's not doing its job. Now the low back and the knee have to make up for the lack of mobility through the hip. So now that we kind of looked at all the stuff that influences the hip, now we also have another kind of player to the game when it comes to knee pain, which is our ankle. So if you think about your ankle, it has quite a bit of different abilities to do certain movements. So if you think about, again, if you're lunging, walking, playing soccer, running, doing CrossFit, whatever it is, your ankles need some adequate ankle mobility. And if you can remember, hopefully you can see, ankles can either go into plantar flexion, so me pushing my toes straight, or dorsiflexion, driving my toes up towards my knee. So like a simple ankle mobility exercise is just me driving my front knee forward and back and kind of going through the range of ankle dorsiflexion. So now if you think about it, even how I'm sitting right now in a deep squat, 1, I need hip mobility to do that, and 2, I also need really good ankle mobility. If I don't have ankles that move adequately enough, just enough in order for me to squat, lunge, step up, whatever it is, again, that knee is going to take up all the work. And if you remember earlier, our knee is a stable joint and it wants to stay stable, but if it doesn't have hip mobility and ankle mobility, it's like a double whammy, and now you're dealing with a lot of shit. So looking at ankle mobility, simple things that you can do. 1, ankle cars to get some motion in there. And ankle cars, I've posted before, but I don't think I've ever brought it up on the show. So if I have my right leg in front and my left leg bent, left hand goes through, right hand holds left hand, and I start drawing big circles with my foot. And what's interesting too is when I bring this exercise in my Kinstretch classes, almost everyone is really good going here into plantar flexion or dorsiflexion, but when it comes to like going onto the inside or outside limits to kind of create that circle, it almost is like choppy and like it's not a smooth movement. Because when is the last time have you ever really moved your ankle to those kind of like, if you look at my hand being flat and that's your foot, going into a, you know, inversion or eversion position and adding like abduction and adduction movements? Like, I don't think we've ever really done it because we always walk straight and never into lateral positions to kind of develop that movement. So now when it comes to like squatting, lunging, things like that, if we already know that those outer limits going into inversion, eversion, we're not that, let's say, you know, adequate at moving in those ranges, again, that knee's going to track in weird places and that can cause some pain. So like knee tracking, if you look at my knee, when I want to lunge or anything like that, it should kind of fall in line where my foot is pointing. And a lot of times when people don't have adequate ankle dorsiflexion where I can go forward, and like when I test ankle mobility in my assessment, the biggest thing is I get people in this half kneel position. I just tell them, okay, to drive your knee as far forward as possible over your toe. And people with really good mobility is just like, yeah, sure, no problem. But a lot of times our body's really, really, really good at cheating movement. I always say this. And it's sometimes a good thing and sometimes a bad thing. So what I usually see, if I am in front of you, and I know I'm wearing all black and I should have worn different clothing, but a lot of times if you look at my fingers, this is going to be to represent my knee. People start going forward, and at your end range where your body goes, oh, you don't have enough ankle dorsiflexion, let me give it to you in a different way. So usually what happens, it comes forward and then the hip rotates out to give you more. So it's throwing you into almost internal rotation, and that becomes like a movement behavior. So every time you're required to get enough ankle dorsiflexion, whole body goes into this position, kind of giving you a false sense of ankle dorsiflexion. And a lot of times that is something called a valgus collapse, where the knee caves in. So if I was squatting and I didn't have one, adequate hip mobility or enough ankle dorsiflexion or mobility in general, stuff like this happens to get more depth, and just even a small little bit, because sometimes it's not both knees, it's usually just like the ones where I'm coming down in my squat and this will happen to get more. And over time, same problem, say I'm doing lunges, split squats, it's just like a small little thing where it constantly caves in, and you know, straw that breaks the camel's back, and now it's like, okay, the inside of my knee is really hurting. So kind of moving forward in the next bit, that's one of the most common things is people get pain on the inside of their knee due to that valgus collapse, because it's just a movement behavior that your body kind of learned to give you a false sense of mobility. Now the other most common kind of painful spot for a lot of people is on the outside of the knee. And again, that goes back to adequate hip mobility, enough ankle mobility, and usually what causes that, if you look at the anatomy of kind of the top of the quad, and let's actually, I think I have a good photo of that. Just hang on here. We're learning together, you know? This is great. Where is it? So, where are we? So this guy totally stole it from a different website, and you can see the copyright in the back, but if you look on this side right here, again, freaking ring light, and we look on the outside where we have our vastus lateralis muscle that kind of goes all underneath where the IT band is, and like, you know, everyone talks about like IT band syndrome. One, you rolling out your IT band over and over and over again is not going to fix your IT band syndrome. It's probably just going to lessen the intensity, but that band is designed to be super, super, super tight. Like you can, I can't remember the number, but they've done a bunch of research where, you know, in order to loosen that IT band, like you almost need like 2,000 pounds of force per square inch to actually like loosen it up. So it's designed to be tight, but that doesn't mean that the muscles of your hip that run down to the outside of the knee, if all of these are super tight, then that's going to kind of pull on all this stuff, and even lightly touching the outside of the knee is going to hurt. So again, we're looking at hip mobility that's preventing you from doing certain exercises, certain movements that'll cause lateral knee pain. Now the other one, in my experience, not that common, but it does happen, is pain on the front side of the knee. And usually, again, quads can be super tight, causing the pain in here, but usually like the front of the knee stuff is due to kind of a sports injury. If you've had like an ACL sprain, tear, things like that, that causes quite a bit of discomfort and pain. Now, what are some maybe like knee friendly exercises? Because I get that question a lot. It's like, hey, if I've had knee pain forever, off and on, it's always been an issue, I've had my ACL reconstructed, whatever it is, right? So one, I kind of look at, okay, we need to have adequate hip mobility, adequate ankle mobility, and when those things are covered, now I'm looking at knee friendly exercises. So things like back squats, probably not going to be a good idea. Things like lunges, probably not going to be a good idea. Things like step ups, probably not going to be a good idea. So essentially anything that requires knee flexion is going to bug the knee like a bitch. Like, think about all that muscular structure that we were talking about that kind of wraps around the knee. You bending it further, now you're lengthening all this tissue, it's not going to feel fucking great. So you're gonna have to find things that don't aggravate it. And when we do that, when we find exercises that don't aggravate the knee joint that's causing you pain, it gives it time to settle the fuck down, and then you can start working on other stuff to improve the function of the knee, which we'll get to pretty soon. So anyone that I have that has knee pain, we'll look for exercises that don't require a lot of knee flexion. So something as simple as glute bridges. So if you look at the nature of the glute bridge, like, yeah, I'm in knee flexion, but most people with knee pain can get into this position without any pain, and we're just doing bridges. We can do single leg glute bridges. We can do feet elevated on a box or a bench glute bridges. We can do hip thrusts. We can do single leg hip thrusts. And from there, if we wanted to get a little bit more fancy, single leg deadlift. Like, that's going to be a huge player, because one, it doesn't require a lot of knee flexion, doesn't require a lot of ankle dorsiflexion, so we're kind of on the clear there. Deadlifts in general are going to be great substitution. We can do hamstring curls with a stability ball. We can do glute bridges off the stability ball. Like, anything that kind of just keeps the knee in one kind of locked position almost, when you think about any kind of bridge variation, tends to help a lot. Now, looking at the knee joint itself. So if you think about it, the knee joint does have movement itself. So there's something like your shin bone, so your tibia that runs down to your ankle up towards your knee. It's able to actually like move within your knee joint itself. So when I am in a seated position and I'm kind of about to do ankle cars like we were talking about before, we can teach and also assess if we have adequate tibial rotation in order to lunge, squat, run, or any lower body exercise. And when I have my Kinstretch classes, this is the thing that people struggle the most. So I've kind of, based on my own experience, realized that two things. Number one, most people don't have adequate control over their knee joint and adequate tibial rotation. And the other one is that people have limited tibial rotation, which throws a lot of things off when it comes to going to the gym. So what a knee car looks like is I drive my toes up towards my face. So now I'm locking out the ankle joint from any kind of ip and it's going to be solely on just the knee joint itself. I'm also placing my hip into as much knee flexion as, hip flexion as much as possible to ensure that I'm only moving through the tibia. So if I rotate externally, I'm moving my tibia right now within the joint, and I go back and forth just like this, almost like a little window wiper, and I'm moving my tibia within my knee joint. And a lot of times, I wish I had a little sticky note, but if you think about it, if you look at my thumb, if I now rotate, now my thumb is out to the side, I rotate in, it's rotating in. So back and forth, I'm moving my tibia. Now, think about this position that I'm in right now. It looks very similar to what we do in a daily basis at the gym. So what exercise forces you to go into hip flexion and ankle dorsiflexion? Squats. So if you think about it from a standing position, I'm going into hip flexion and I'm needing ankle dorsiflexion. So what I'm actually doing is asking my body to get adequate tibial rotation. So what if, based on my experience again, in my kin stretch classes that basically everyone that attends, and they do get better over time, has no control of how this tibia moves, or they have limited tibial rotation, where's all the pressure gonna go? It's probably gonna go into your low back, and it's probably gonna go into your knee over and over and over and over and over again when you're doing squats. And then on top of that, you've signed yourself up to a boot camp bullshit thing where you're doing squat jumps and burpees that all require adequate tibial rotation. So over and over and over, it's like a square peg in a round hole going through, and now you have knee pain. So really when it comes down to how to fix knee pain is finding exercises that don't flare it up, which we've already went over to, and getting adequate mobility through your ankle and your hip, which we've already went through, and finding control over your tibia and getting a little bit more range of motion. So, exercise prescription for all those things. Hip cars, which I already demoed, would be number one. Hip 90-90 for external rotation. Finding your end range, holding it for 2 minutes. At the top of 2 minutes, you're going to do pails and rails, meaning you're going to drive your ankle and knee down into the ground as hard as possible for 10 seconds. After the 10 seconds, you'll realize you'll be able to go a little bit further because you just spoke to your nervous system asking for more range. From there, the next thing is your rails. So you're going to ask your nervous system again for more range of motion by thinking of driving this leg up off the ground without leaning back. And then you're going to do the same thing on the other side. Then, for the ankles, you're going to go into a half kneeling position, get into your end range of ankle dorsiflexion. Pails and rails after the 2 minutes, and essentially what you're going to do for pails is you're going to be driving your toes down into the ground as hard as possible for 10 seconds, release, get a little bit further, and then rails will be your toes going up for 10 seconds. And then for tibial rotation, again, all of these have to be pain-free. If they're not pain-free, then you're not ready. You're going to be in a half kneeling position. And guess what? You're going to rotate your foot in, keeping your knee where it is. And now we have some rotation into internal rotation of our tibia. And then pails and rails will be trying to push your foot against your fingers. And then rails will be trying to coming off it without lifting up the heel. And then you do the same thing the other way. Pails and rails here, pails and rails here. Those three for creating more range of motion, as well as ankle cars, knee cars, hip cars, finding exercises that are not required so much knee flexion like I'm in right now, this deep squat. And over time, it will get better. It's just being patient. And again, yes, you can layer on top some physical therapy, chiropractic, whatever it is, to kind of speed up the process. But a lot of times it's just finding what works, keeping at it for a very long time, and the knee pain will go away. Again, the biggest thing when it comes to training around knee pain is to ensure you're not going through pain. And when pain is present, backing off and finding less range of motion within the exercise you're doing, eliminating the exercise completely, or something else. So that being said, that was a lot of information. If you have any other questions based on knee pain or your knee pain specifically, let me know and I'm happy to help. Hit the show notes, add me on Facebook and Instagram, subscribe to my YouTube channel. For all those who are listening right now, hit the show notes and watch this video. I do demonstrate quite a bit of stuff. And that's it for me. If you guys have any more questions, feel free to reach out. And that's it. Until next time.
What is up, my podcast listeners? This is your host, Rafal Matuszewski, and we are doing another presentation-styled episode today, and I am super excited about it because we are going to go over the topic of knee pain. I think for the most part, all of us have probably, experienced some sort of knee pain, knee discomfort, something to do with our knees. And it can go from, some sort of impact injury, um, as simple as like you like losing your balance and fucking falling onto your knee, to a point where you walk a corner too fast and hit the coffee table really fucking hard and you end up falling over and, being super, super exaggerating of how terrible that was, to playing a sport, getting, cut by the side and tearing something, or simply you start running and your knees start fucking hurting for some reason. So we're gonna kind of go over the things that I see, at least, in a clinical setting and also from a training setting, and what I do about it. To kind of begin, we're going to start off with anatomy, of course, because that's what you do. And we're going to have to do a screen share. Every time I do this, I always forget how to do this. All right, screen share. Make this bigger somewhat, and I'm also going to make myself bigger so you guys can see my beautiful face. All right, well, this image is kind of small, but I'm going to do my best. And for those who are listening, 100% hit the show notes and watch this video, because we're going to go through anatomy. We're going to be going through exercises that you should be doing. And, I will be try to be as descriptive as possible, but it's always better in video. Which reminds me, if you guys have not subscribed to my YouTube channel, what are you waiting for? Join the other 355 people that watch and support me, because my goal for 2022 is actually to get to 1,000 subscribers on YouTube, because I want to start doing more stuff like this, more video stuff, more visual stuff. So if you haven't done so already, hit the show notes and watch and subscribe. Okay. So let's go into this thing. So this is our knee joint from the front view, from the side view, and from the back. So the big patella, the big bony thing in front of you, is part of the knee joint, and it kind of just floats on top, because like if you have your leg extended, but not like to a point where you're extending, where you're activating like your quad muscles, you can actually move your tibia back and forth for just to see if you actually have movement. And a lot of times when people have a stiff patella, then that kind of leads to not the greatest sensations in your knees when you start running or doing any kind of single leg work. Or even when it comes to, you just had an ACL surgery or any kind of surgery around your knee and your patella is not tracking the way it should, then it could just be like some scar tissue stuff and you need to work that out. But there should be some movement with the patella. That being said, it kind of floats on top, and it's supported by a lot of like tendinous and ligamental structures to keep it where it is. And then you have your shin bone called your tibia. So if you imagine, if I can get my knee up here, this is actually pretty good. So my patella right dead center, and then my tibia, this big bony thing, is right here. And then we have something called your fibula, which is actually not in here, but it's this guy right here, pointing with my little mouse cruiser there. And it's the little bony part on the outside of your knee. And the reason why this is all important is that when you walk, squat, your tibia can actually move back and forth. And you can kind of see I'm literally just doing internal and external rotation of my tibia. And if I have with me, sorry guys, I'm trying to get more of a visual. I might not, ooh, maybe this will work. I was looking for a sticky note, but this, and hopefully this works. I'm totally just hoping that it works. So I have this little paper clip. It's not gonna work, and I might have to do it a little bit further down. I just love when I come up with random shit and you can think that I'm full of shit, but hopefully this works out. Yes, okay. So the little paper clip that I have up here that I just cleverly put together represents where my tibia is. So right now it's pointing towards you. And if I think of rotating it to the right, and yes, your knee joint can rotate, it doesn't just, extend and flex. So look at the origin of where my knee is or my tibia is. And now look at where it's pointing, out this way. And now I'm back to the center. Out to the side, back to the center. So why is that important? Well, when you decide to squat, that tibia needs to be able to move. When you decide to run, that tibia needs to move. When you decide to do a lunge, that tibia needs to be able to move. When you deadlift, that tibia fucking moves. What happens when your tibia doesn't have that range of motion? Knee pain, ankle pain, hip pain. One of those three things can happen. And a lot of times when people say like, oh, my freaking knee hurts, I don't know why, like I'm foam rolling every single day, I'm doing mobility, whatever that means. And I do this with everyone. I check tibial rotation because they don't have it and they're telling me they're going to the gym 3, 4, 5 days a week, or they're deadlifting and squatting all the time and their numbers are not going up. And I'm like, well, yeah, you're physically fighting your own like anatomy and biomechanics of how far you can take your body. And this is something people don't ever think about when they exercise. And all of us who go down this whole realm of like health and fitness, I want to lose weight, I'm going to start running, I'm going to start doing a leg day because that's what Instagram is telling me to do, but you're limited to what your knee joint itself can do, right? So this is important why you need to know anatomy. This is why it's really important to exercise selection and how to stay pain-free, because we all know, and I've brought this up on my show so many times, that in order for us to be successful, we need to have consistency, right? We need to have a certain amount of workouts every week. We need to have enough, calories burned, but you can't do those things if you're constantly dealing with knee pain. And it can be something as simple as like just getting more range of motion of, your tibia. Like it's not rocket science. So now the question becomes, well, how do I get more range? And when you look at, like say the definition or a description of what a joint is, we all know that joints are designed to move. So then the next question becomes, when was the last time you moved your tibia? And most people look at me like, what the fuck are you talking about? Right? And, again, I'm biased, Kinstretch instructor, huge fan of Dr. Andrew Espina's work, but it makes sense to me. Like if you don't use a joint the way it's designed, then you're not gonna like maintain its function. If I take my elbow and keep it like this every day for the next fucking year, it's probably not gonna be that great to extend it to where it's supposed to go, right? So same thing goes with your knee. If you don't practice what it's capable of, it's never going to give you those options. And sure in hell won't give you the option to do so when it comes to a squat, like a back squat, where you fucking have a barbell loaded onto your spine and you're just hoping for the best when you're trying to do 195 pounds. So let's get into some exercises, which I've done before. For this one specifically, but we're going to go over knee cars. Hopefully I have A good video. So here's one exercise. We're gonna probably go through all of my cars exercises that I have. Come on, full screen, do your thing. All right, so I've brought this up before. So we're literally doing the thing that I did showed you earlier with my own leg, and we're just going from external to internal rotation, right? And you can literally see, like, actually this guy right here, fibular head, but we were looking at before as I changed my side. But yeah, we're just going back and forth. And the key thing here is, like, look at the angle of my ankle. If I had my foot out straight, then I wouldn't really get that much rotation. And I don't know why I pressed play, but yeah, I wouldn't be able to get enough rotation having my foot in plantar flexion. That's why I need to make sure the ankle is locked out. So then you can move primarily just through the tibia. That's one option. Now, going back to my previous statement of, if I don't use my joint the way it's designed and I limit, it to, in this case, being in a flex position, knowing that my knee can also extend, then I'm leaving a lot on the table. So what you do is also practice knee cars with extension and flexion. And I think this is a video where I talk, or maybe not. Okay, good. So I'm going to flexion, going back up to extension, and I'm doing tibial rotation in that extended position because your knee can do that, which again should be part of normal knee function. So something like this is, for me, I do every single day as part of, like, my warm-up routine, or even before my kin stretch, or if I'm back squatting or doing lunges that day in my workout, then I'm going to do this as my warm up, right? So there's ways to also isolate that motion, and a couple of them is this guy. Come on, load, 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 load. All right, so I have a yoga block in between my knee, and now you can see that I'm going back and forth between external and internal rotation. And it's something that, most people can do. It's a different position you're standing rather than seated, something to play around with. But if I had someone with a really, really sticky tibia that does not move, then we need to do some pails and rails. So I have done a lot of content on pails and rails, so I'm not going to go over that in depth, but it's important to note that pails and rails is the magic sauce when it comes to creating tissue change. So I literally have put my tibia in a externally rotated position, and I have a full stretch. So in this sense, and this can be a little bit aggressive for most people, like, it's a yoga block, it's quite big, so you might want to start with something smaller. And I'm literally just holding that for about 2 minutes. After the 2 minutes, we're going to start doing our pails and rails contractions, where we're force feeding our nervous system at a cellular level to influence the tissue for change. So now I'm pushing my foot down into this block as hard as I can to affect all the tissue at the top here of my shin. After that, I'm going to do the opposite, where I'm going to try to drive the toe off it, which is going to be impossible because I'm at my end range. But now I'm creating an isometric contraction on the other side of my tibia and all the tissue underneath. So now I have some tools in my toolbox to create better moving, a better moving knee joint, essentially. But the other thing that people don't think about a lot, and this happens a lot in the clinic, people come in with knee pain and they're like, I need your help. I need you to help treat the knee. But then our practitioners, and myself included, when we assess the person, I would say 9.9 times out of 10, when it comes to knee pain, you check their hips and their hip mobility is terrible. So let's look at, there it is. Full screen this, yes. Such a better photo. Okay, front of the leg here. The big thing is look at all this white stuff, right? At a certain point, all these muscles that run from the hip coming down blend in with each other. For those who've done a cadaver lab or have seen cadaver dissections, if you were to have this section in front of you getting really close to the knee, it's going to be really, really difficult to figure out, which one is the IT band, which one is the rectus femoris, which one is the sartorius, which one is which, because they all blend in together. And this is the whole concept of bioflow when it comes to movement and how everything is literally integrated with each other. Yes, there are separate muscles, but they all intertwine with each other at certain joints, especially from the hip to the knee, in my opinion. A couple things that I always see is people will get, say, pain in the front of their knee, right? But again, look at all this stuff that blends into this one area. There's a lot. So if somebody has a tight hip and they have these muscles that run all the way down to the knee, then the line of pull from here to here is going to start tightening up. So sure as shit, your knee is not going to feel good if all this stuff is constantly tight, aka you sitting every single day and being inactive, right? The other thing too is people will start running and their IT band gets super tight. And again, the IT band is designed to be tight, but for most part, we already have tight hips, tight quads, and now you start running where literally the motion of running, every time you do a stride and your foot goes down to the ground, all your quad muscles are designed to prevent your knee from hyperextending and popping out of place. So every foot contact with your body weight of, say, anywhere from 150 to 250 pounds needs to be stopped multiple times. Like in a mile, the amount of foot contacts per leg is around 1,500. Like, holy shit, that's a lot of work for all these muscles to prevent your knee from doing that, right? So you're taking this individual or yourself with a really, really, really tight hip and tight quads, and now you're adding this. Sure, yeah, your IT band's going to get overworked and stay even tighter because it's trying to do its job. But now you're just kind of fueling the fire with more gasoline on it, and you got knee pain. But now imagine you have this other muscle, which is super important in my opinion, called your sartorius. It starts from the hip and works its way down all the way to the inside of the knee, wraps around to the front. If you're telling me that your hip has no influence on how this knee feels, fuck. So for me, when I do Kinstretch, what's really interesting is seeing how people's bodies have adapted. And when I do any adductor work, because the sartorius is an adductor and a hip flexor. So when I do those two motions with people's hips, they're really weak, really, really weak. And what happens in our body is when something is weak, something else has to make up for it. And usually we'll make something else tight to compensate for it. So we have all these things that are working against us, and we're surprised when our knee starts hurting, right? Like, I'm literally just scratching the surface on all of this stuff because I can talk forever on hip mobility, knee pain, knee motion, things like that. So to kind of make it simple, if this hip does not move, then the motion that is necessary for you back squatting or running or walking is going to have to be made up from either the knee, and worse yet, the fucking lower back, which is another joint that's not meant to have so much range of motion. It's meant to be stable, right? So that's how our body works, is if one segment or one area doesn't move the way it should, the thing above or below it is going to have to do more work. Now, the other thing, and I don't have a photo of this, or actually, you know what? Let's do this, because I want to quickly get into. We're gonna have to take a little trip down to Facebook land. And if you don't follow me on Facebook, you 100% should. I posted actually a couple days ago on the ankle. Yes, I love when things work out. So remember how we were looking at the knee, the tibia, which is right here. Now, remember how it's supposed to rotate? What if this joint here, your ankle, doesn't move as well as it should? Now, if you think when you squat and you're descending down, your tibia doesn't stay upright like this. It has to go forward into an angle where your knee almost goes in line with your toes. So what if this joint, like your talus, doesn't move and glide the way it should, and you get to a sort of sticking point, and that's as far as it can go? And where is the made up range of motion is going to come from? Probably your knee, probably your hips. What if your hips also suck and you're literally just jamming force into your knee joint? That shit's going to hurt too over time, right? This is the other thing that people don't think about, is like, do I have adequate ankle mobility? Maybe, maybe not. So we have that. The other thing I wanted to go over too is another photo of the anatomy of the knee. And let's look at this. So we talked about the tibia, talked about the fibula and the patella. But now in this knee, we have all these, you have your meniscus, all the cartilage, you have your ligament and everything else. So again, this can be another huge, huge, huge topic. But one of the major injuries that I've seen is an ACL tear. And when people get surgery done, the number one thing they need to do is, one, go through the whole, physio initial steps from the hospital that allows you to get discharged and, go home and again start doing your rehab and physio, but regaining extension. So remember how I said how our quads are responsible to ensure that you don't go into hyper extension with your knee. But when you get an ACL surgery, it's really difficult to get extension back. And when you think about it, like, we need to be able to extend our knee, and people will say, like, sometimes it just feels like locked or stuck and it can't move any further. So learning how to regain extension in a safe environment, and I'm not saying that you should do this on your own. This is where you need to hire a professional or someone like me who understands anatomy and movement to help regain that mobility. But a lot of times when people do their rehab and physio half-assed, they don't get that back. And then they have this weird feeling of instability in the knee, and they feel like it's just going to pop out. And then the joke in my industry is, like, when you meet someone with an ACL tear, you ask them, when's the second time you tore your ACL? Because usually the people don't become, diligent with their rehab and movement prep when it comes to regaining range of motion in their knee. They kind of just like settle it, because what do we do most of the time? What I'm doing right now, sitting, I'm having my knee in a position of like 90-degree of flexion, and I'm not going to extend. Like, I don't know for you guys, like when I'm sitting watching a movie in the theater, like, I can lean back and just extend my legs all the time, because then my knees just like feel terrible if I don't extend them. But I think I'm going to leave it at that, because that we've talked a lot, or we didn't, I did. I'm going to try to get off this screen share. There we go. Okay, so knee pain, huge contributors are your hip mobility and ankles. If you indirectly influence those two things, your knees are going to feel better. The analogy I give all the time to clients and patients is, imagine if, you're looking at my ceiling right here and you see this huge like stain. You're like, okay, that's water. Would you, as a homeowner or a renter, obviously you're not gonna never mind, I was gonna go on a weird tangent. You wouldn't be like, oh well, I'm just gonna patch that up and it's gonna be good, because we all know that a month from now you're gonna see the same thing and it's gonna get worse. So when we see that there's that circle of water damage, we right away know, okay, well, above that ceiling there's something that is causing that leak, so we're gonna have to open up the ceiling and fix it and then repatch the ceiling. Our bodies are the same thing. If my knee hurts, I'm not gonna just go treat the knee, because most likely the thing above it is causing the pain. So my goal, I guess, with this episode is, not only is it to help educate about knee pain, but to go seek out individuals and professionals like myself that have experience to help you through it. Because a lot of times it's not just, I'm just gonna, rock tape or put a brace on my knee and foam roll the shit out of my IT band. It's other things that you need to be more proactive with, and choosing exercises that you may not be able to do just yet that will help improve the amount of force being put down onto your knees. So I'm going to end it there. Hopefully that was helpful. Hopefully you enjoyed it. If you have any more questions about knee pain, hip pain, ankle pain, any joint really, feel free to reach out. Add me on Facebook, add me on Instagram, hit the show notes and watch this episode, and also subscribe to my channel. Keep an eye and ear out for my new book. I'm almost done. I'm just putting it all together, all the finishing touches that are super annoying and not fun like when I was writing it. But the new year, I'm going to drop my book, The Ironclad Body Training System Volume 2. That is it for me, you guys. Until next time. What is up, my podcast listeners? This is your host for Matuszewski, and I'm excited for today's episode because I'm going old school and using my mic setup, as you can see in this video. So hopefully the quality of sound is better than my AirPods that I've been using. And we are going to get right into it because we have a lot to cover. So a couple people reached out on my episode about knee pain specifically. And if you haven't watched it, I'll link it into this episode in the show notes. So definitely watch that. And we're also going to go over a lot of exercise stuff. So if you are listening, I would 100% watch this episode. So again, when you have a chance, hit the show notes and click the link to watch this episode, because we're going to go over all knee friendly exercises. Because in that last episode, we went over a lot of, anatomy. We went over the mechanisms of knee pain, some injuries, what happens to the knee when it comes to, positioning and things like that. So that was kind of like an introduction. So I was thinking, for part 2, because I had so many people reach out like, hey, I do this exercise and it hurts my knee still. Should I be doing it? And I had another question where someone asked, I do this exercise. Sometimes it hurts, sometimes it doesn't. So there's a lot to it. So we're going to go over an exercise specific if you are currently dealing with knee pain. So the exercises that I'm going to, air quote, prescribe only will work if you're an individual that has, seen a physio, chiro, or some sort of medical professional to help, guide
the recovery of the knee injury in the right direction, and you are cleared for exercise. And most of these exercises tend to be somewhat safe. And that's kind of like a general term because, again, I can say that this exercise is great for you, but, you put it into practice and it still doesn't feel right. And there's a lot of factors that come into it. So I can't have like a blanket statement of, do this exercise and all your problems will be solved. These are, from my experience in the industry of 12 years, that usually these tend to work better than some. So I'm going to share my screen and perfect. I'm going to full screen this. I'm going to make myself a little bit bigger. Come on now. Oh no, you guys are also getting a little preview of my book, which, by the way, I'm going to bring up. So yesterday, I believe, or the day before, I can't remember what day, I put out the official notice that my book is going to be coming out this January. And the cool thing is that in my ebook and the physical book, if I get all my shit figured out, you are going to receive full-on Kinstretch workouts. So if you can already see on my screen here, I've uploaded 6 and I have 2 other ones. So you're going to get a full 8 Kinstretch workouts in my new book that you can literally click play and follow along, which is going to be super cool. But anyway, let's talk about knee exercises. So we're going to talk about foam rolling first. And before we even get into it, I've done a full-on tutorial on foam rolling. I've done a full-on episode on foam rolling, which is right here. It's episode 348. You can either watch it or you can listen to it. Again, this episode in particular was done in my car, so you don't really need to watch it unless you want to watch my face as I talk. But the reason why I want to bring up foam rolling, but I'm going to have a full foam rolling tutorial. So if you go on my YouTube page and just type in foam rolling tutorial, you'll find it. Okay, what do I want to, this guy. So when I work with anybody, every single session starts with foam rolling. And here's the thing. Foam rolling is not going to, fix all your issues. It's not going to change tissue quality. It's not going to, I wonder if I can get this in HD. Never mind. It's not going to fix your pain. But what you're going to do is, 1, influence your nervous system, and 2, kind of tell it to ease off on the e-brake. So our nervous system literally controls everything that we do when it comes from a stress response to a pain response. And in this particular case, we're trying to influence the pain response. So for the most part, many of us who deal with a regular job, we sit. And, I cover this topic so many times, and we all know that our hips are pretty tight because of sitting. So when we go to the gym, if you think about all the muscles attached to the hip on the front side, so like say your quads, your TFL, your hip flexors, all those things have all this like neurological tension on it because we've been sitting in this chair like I am right now for a prolonged amount of time. So now there's stress and tension on it. So now imagine you trying to do a back squat or a lunge or something athletic. All those muscles in the front of your leg have this built up tension. Now imagine you trying to perform that exercise and it's pulling on stuff attaching to your knee. Because, we've done a lot of anatomy stuff on my podcast and on my posts, like, which I need to start bringing up again. But there's a lot of muscles that cross the hip and knee, or, just cross the knee in general, that play a huge role in lower body exercises. So now imagine that you've sat for 10 hours and then sat in your car to drive to the gym, and you have all this unwanted stress and tension on
the musculature around the knee, and now you're trying to do a lunge, like probably it's not going to feel that great. Because one of the biggest complaints I get from people with knee pain is that certain leg exercises bug their knee. And it tends to be a lot of exercises that are, knee dominant, like step ups, walking lunges, forward lunges, lunges in general. So those exercises tend to flare it up. But what if I had a device, AKA the foam roller, that could possibly communicate with that nervous system to be like, hey, you don't need to keep that tension on, the IT band, TFL, quad, things like that, to give you a little bit more range. So now I'm actually going to play this video where, I start off rolling not only my IT band, but I'm also going into my quad, and I'm also going to go into like my TFL and everything like that as well. Right. And yes, you can get into stuff as, no, don't roll your IT band. It's designed to stay tight, which is true. But I would make the argument that, if you're sitting all day, you're placing more, information to your nervous system to keep all those muscles that attach to the hip and the knee, aka your IT band, to be even more tight. So if I could release some tension on there, even though the IT band will stay tight, I know it sounds redundant, but it will ease off a little bit, and that's going to play a huge role on preventing that, unwanted knee stress, knee pain. So every single client that I start with, I'm going to foam roll all those, culprits that tend to be tight that are going to affect the exercises that we do. So now imagine, I spent like, and again, I spend like maybe 5 to 7 minutes in the hour on foam rolling, and that'll be the entire body. Or if I have a more lower body focused exercise, then we're going to spend a little bit more time to get the nooks and crannies of that lower musculature. But this is how we start. So now that I have some information being sent to the nervous system to, settle down, getting some blood flow to the area, now we're going to mobilize it. So a lot of times with my people that are not happy with their knee progress when it comes to pain, we need to mobilize the musculature around that knee joint. So one big thing that tends to happen is that, hip flexors are super tight. So from foam rolling, I will literally work on, hip mobility. So right now I'm doing a half kneeling hip flexor stretch. And the key here is, well, as I turn to the other side, you see my toe in the back. I'm cueing my hips to do a pelvic tilt to kind of get more tension on all the musculature in the front of the hip. And then I'm also pushing down with my hands down to my knee to create a little bit more contraction through my core to kind of send more of a signal to my nervous system that I'm trying to influence this tissue. And then I'm rocking forward and back with that hip. So we take a second here. Yeah, I'm rocking forward and back. So now we're influencing the stuff that influences the knee, because the knee, which I've said on the podcast before, is AKA the stupid joint. It's dictated by what the ankle and the hip does. So I need to influence the hip and ankle to move a little bit better to ensure that the knee tracks in the right direction when we're doing lower body exercises. So now I'm doing, my hip flexors and quad and things like that. But, this exercise might not be good for you, like I said in the very beginning of this episode, because being in this position might be causing unwanted stress on that hip flexor. So there's a couple of things. Something as simple as like, let's put a little foam pad underneath the knee. That tends to fix it. But sometimes when people have really flared up knees, really bad knees, they've had surgeries 20 years ago, and now they're trying to get back into it. Like, this is probably a no-go, but you can play around with maybe not doing the pelvic tilt, maybe not squeezing the ass as hard as possible, maybe just doing a simple rock or getting used to the position, or maybe just getting rid of that back toe. All great options, right? So now we have done hip flexion, hip flexors, and things like that.
But what also influences the hip? Well, we have our external rotators. So one of my favorite exercises that we're going to get into is our 90-90. So let's just type in 90-90 and we'll see what we get. And if you haven't subscribed to my YouTube channel, 100% you should, because the amount of videos I have on here for a resource, like I'm pretty sure I'm close to 2,000. So, oh, of course we would have an ad as I'm trying to do this freaking, I wonder if I get money for this. Probably not. But I'm going to move myself over here. So we have our 90-90 position before I go in. So the big key here is knee in line with the front hip, knee in line with the ankle, and same thing in the back. So we have our 90-90. What we're doing here in this upright position is we're arching low back, because that's going to open up the hip capsule and all those external rotators of your hip. So when it comes to knee stuff, if I'm going to squat, I want to push my knees out on the way down, on the way up. If I don't have enough external rotation of my hips, my knees are most likely going to cave in, favoring internal rotation going, oh, sorry, I hit my microphone, favoring internal rotation, going into that valgus collapse, and you're going to look like, you know, a melted candle trying to come back up into your squat. So we're going to influence all those tissues to help us with hip external rotation. But look at this mastery of cleverness I come up with. So we did hip flexors earlier, which is responsible for hip flexion. So if I'm going to be doing lunges or squats, it requires an adequate amount of hip flexion. So if I've been sitting all day and making hip flexion stiff, it would make sense that I need to work on that in my warm-up in order that my squat and lunges will feel better and my knees will have less tension. This is what I'm talking about when it comes to like proper training. And I feel like I'm going to go on a tangent right now because, you know, so many people that will come up to me, they'll ask me questions, and then I give them a response of like what I just said, and it makes sense to them. But I'm like, how do you find that information online when you're trying to navigate your own health and fitness? You know, like, yes, you can go on YouTube and search up free workouts, you know, 20-minute yoga, power, whatever, or like high intensity intervals, sweet, right? That's for generalized people. But what if you're dealing with something completely different than all the other 7,000 people that watched that video, that did that workout, and that found it okay? Maybe your low back doesn't like it. Maybe this, maybe that. It's similar. And I give this analogy all the time. It's like, you know, my dishwasher breaks. Sure, I can go on YouTube, find that exact model, find a great tutorial to fix it. But when I go in there and spend like 3 hours trying to do it, while the video literally shows the guy doing it for 3 minutes because he's somewhat more capable than I am, because maybe he has a construction background, maybe he builds houses for a living, who knows? But he's somewhat of, you know, above average in that field and has that knowledge. So, you know, yeah, I could fix it after 3 to 4 hours, and most likely 3 months, 4 months, 6 months down the road, maybe a year from now, that dishwasher is going to go again because I didn't put, you know, the expertise that, you know, that guy who made the video might have. And I could have just hired someone like him or her to come in and just fix it and pay them for the hour, maybe even 40 minutes, save myself a lot of time and a lot of money just getting it done professionally. And this is where I find people, for some reason, in the fitness industry, it's like everyone thinks that they can do it on their own. You know, like I spent literally 12 years of my life trying to perfect my craft. So when people are like, you know what, thank you for all the free information that you always give, but I'm going to do it on my own. And it's like, sweet. Like, yes, I want to help people, but at the same time, it's like, you're going to end up hitting a wall. And this is where like individual recommendations and individual approaches come in handy. Like, you know, me trying to fix my own car, yes, I can go watch the YouTube video and hope for the best, but when it just makes more sense to give it to someone that's a professional and make sure it's not going to crap out on you, right? But that's a whole nother podcast maybe of why you need to hire a trainer. That's good. Anyway, we got the magic sauce here. Hip 90-90. We are getting those hip external rotators and flexors ready for our workout. So it's simple, just forward and back to shorten and lengthen the musculature to prep the body. So now we have gotten two specific things for our knees to be a little bit happier when it comes to squatting and lunging. So now let's get into the ankle joint, but we're going to go back to the hip joint too, because how I also create warm-ups specifically is we're starting from the bottom up. So if I'm doing a warm-up, it'd be kind of stupid for me to waste time because I want to be efficient in my workout. I want to get as much out of it. And honestly, this can be another episode too about, do you really need a full hour of training? Right? Who came up with that? Like, think about that right now. Who came up with this whole idea that you have to work out for an hour? Think about where that came from. I don't even fucking know. Right? But what if you're an individual that literally has so much going on and you could only do like, I don't know, 20 minutes? Maybe that's your jam. So if you have 20 minutes, how do you prioritize a workout? Like, these are the things you need to be asking yourself. But anyway, by the way, we're at 361 subscribers, guys. If you haven't subscribed to my YouTube channel, 100%, you got to do it because I post a lot of new stuff and it's great value. We're also going to influence this ankle. That's where I was going. I'm going a lot of tangents here. I'm so sorry. So ankle cars. So I've played this before, and I believe I might have played this for the last video on knee pain. Man, we are getting a lot of ads today. I'm not hacking metabolism, hey? Oh, interesting. Oh, you know what? I think this might be, well, this is so good that we're going over this. I'm pretty sure this is for seeing if you're in ketosis or something. Oh, interesting. I actually had someone reach out to me from a company that has literally one of the same products where you have to blow into it to see if you're in ketosis. And I was like, you know what? I'm going to try this. And I never got around to it. But anyway, sidetrack. Ankle cars. So if I'm going to influence how my knee is going to move in a workout, we covered the hip a little bit. And now we're also going to cover the ankle. So we're going to do ankle cars. Nice and simple. Big ankle circles. You can also do just standing ankle dorsiflexion going forward and back, but you want to cover those ankles if I'm an individual that has knee issues, knee tightness, knee flare-ups, knee pain of any sort, to make sure that my ankles are loosey-goosey and have enough range when it comes to doing lunges, squats, whatever. So nice and simple. Ankle cars, you got that on my YouTube channel that you're going to subscribe to at the end of this episode, right? All right, so now we're going to be standing. We're going to influence the hip a little bit more and more dynamic setting, environment. So we're going to do hip cars. And hopefully I have an updated hip car for you guys. You know what, we are going to go with, yeah, there's a lot of variations, but one of my favorite ones is my wall facing hip cars. So with this one, it's really good in the sense that you're not going to cheat because you're going to have full kind of feedback if you're leaning over to cheat by that other elbow, so my left elbow bending. But now I'm taking my hip through all the planes of motion that it can do. So right now I'm coming up into hip flexion, hip abduction, hip internal rotation, going into extension. And then same thing, we're going to go back, hip extension, hip external rotation, back to flexion and back down. So when you think about it, the hip can move in so many different positions, and it would be stupid of me that if I'm going to work out and move my hip in all these different positions because I want to do lunges and squats and deadlifts, it would make sense to warm up my hip joint the way it's designed. So there you go. We have hip cars. So we covered a lot of mobility stuff, right? What is this? And we haven't even covered exercises that you should be doing instead of things that will hurt the knee. So these exercises I just gave, yes, they are part of your warm up. But these can also be your AKA rehab exercises for someone that's dealing with knee pain. Like me working in the clinic with patients that have knee pain, these are the exact same exercises that I give them. Like these are that tipping point that if you are dealing with pain, I want you to be efficient at them so then you can move past your block when it comes to seeing success. Because that's like the worst thing is that, people are trying to lose weight, they're inactive, think shit hurts. And then you go to the gym and you have this mentality of no pain, no gain. And, you're pushing through it. And then eventually your body goes, fuck, stop being stupid. I'm going to stop you and shut you down all completely by creating more tension in that knee joint, and you're going to feel pain and I'm going to stop you. So now you have to take time off and kind of go through the cycle of taking time off, getting consistent, taking time off, getting consistent. And over a year span, you're not going to see, the results you're hoping for. So in that case, if someone can do literally the exercises that I just gave them in this video every single day, they're going to see huge, huge changes. But whole nother story that we can get into. Let's get into some knee friendly exercises. So big thing is we're going to go into reverse lunges, and we're going to get into this guy. So why do reverse lunges work beautifully for knee pain? So in this video, you can see that I do have quite the angle of the knee kind of hovering over the ankle, right? And this is your typical reverse lunge where you're going to have somewhat of knee flexion. Again, that's not wrong. But if I had an individual that's like, yeah, my knee sometimes hurts when I do reverse lunges, then rather than having this kind of shin angle, I would have them go further back. So in this video, when I take a step back, I'll take a bigger step back, and I kind of do this in this rep. But if I had my back foot like 3 inches further back, guess where this knee is going to end up? It's probably like, if this is the front of my knee, it's probably going to end up here. That's going to be in line with that ankle. So you won't have the stress of all this like musculature here. If you look at my cursor, going over top of my knee, it's going to have less of tension on here. So now most likely this is not going to bug me at all. So we have this exercise. Say that doesn't work, or it does work and now we need more options. And we are going to get into some single leg deadlifts. So let us find, what am I doing? There we go. We're going to show a contralateral, which I'll also bring up what the hell I just said. So a contralateral load is when I am holding the kettlebell, say on this case, the right side, and my left leg is the working leg. Let's get myself a little smaller here too. And the reason why I do this compared to, say, coming down and having this kettlebell on this hand while this leg is working is that most general population don't have enough hip stability to prevent this opposite hip from like poking up towards the ceiling, and it becomes a balancing act. Whereas a contralateral load, your body's forced to stabilize. And the joke that I always make is that, if I could get somebody single leg deadlifting in a contralateral load like this video with like 45 pounds, all their issues and problems in the gym would go away. So let's look at the mechanism behind why the single leg deadlift is like one of the best exercises. And we're going to go from the bottom up. So in order to do the single leg deadlift, my foot needs to be stable. My arch needs to be strong. My big toe needs to be able to press down into the ground to activate my glutes. My knee needs to learn how to be stable. My ankle needs to learn how to be stable. My hip needs to learn how to be stable. I'm working my grip strength by death gripping this thing. I'm learning how to create shoulder stability. I'm learning how to create low back stability. And then from that, I'm also learning how to strengthen up my hamstrings, my adductors, my hip external rotators, basically any hip stability muscle out there. And this exercise just is literally an end all be all. And when it comes from like a performance standpoint, having this load on a contralateral position, it's literally pushing me down. So I have to resist rotation. So now this becomes like an ultimate core exercise that most people don't do. They kind of just skim over the single leg deadlift and they're like, I'm just going to go barbell deadlift. Imagine if I loaded this thing, like I could take any dude in the gym, in a public gym that's like, say, deadlifting 300 pounds and doesn't do any single leg work, and give him like a 12-kilo kettlebell, like he would be falling over like no tomorrow. But imagine that person that can deadlift 300 and was able to deadlift like a 150-pound dumbbell or whatever, like some sort of 150-pound load contralaterally, and then try to do a double leg deadlift. Like, fuck, those numbers would go up really fast. Anyway, ultimate exercise. But the nice thing is that the single leg deadlift tends to be very knee friendly. Yes, I do have slight knee flexion, but it's not so much that, you know, it resembles a forward lunge or a walking lunge that pushes down onto the quads, because it's not a quad dominant exercise. You're getting more hamstring and glute than anything. So it tends to pull off any kind of pressure on that knee. And I would say 9 out of 10 times, this is a great solution for people with knee pain. But let's continue this lovely journey onto the next one. So we are going to look at a lateral split squat. And let's go with this guy. I have a lot of variations, obviously. All right, so traditionally lateral lunges are not the greatest for knee stuff, but when you look at the lateral split squat, and I'm going to pause it here, what does this kind of resemble? It's a hip hinge, literally the lateral split squat, because I'm not taking a step. And that's important, is that when you're dealing with knee pain, doing anything where you have to take a step and decelerate, that's all quad. Like your quads are built to ensure your knee doesn't go into like hyperextension. That's why when you go hiking and you're hiking back down on the mountain, the next day your quads are destroyed, because it's literally like every single step that you did for like an hour, your quads are like firing like crazy to make sure your knee doesn't like hyperextend. So when it comes to creating more control and creating a better environment for your knee, a split squat compared to like a full-on lunge that requires locomotion tends to be the better choice. But the point that I was trying to make is when you look at the lateral split squat, or even just lateral lunge in general, your body goes into a hip hinge. And I remember going to a conference and a really smart guy named, what was his name again? Doesn't matter. Said that when you look at the lateral split squat, lateral lunge, it's literally a lateral deadlift. And that kind of like blew my mind. It gave me so many light bulbs. And I was like, damn, that's like really freaking good. So if we go off that logic, then a lateral split squat should be good. If we eliminate lateral lunges, which requires those quads to activate and decelerate, and again, put unnecessary tension on that knee, then, you know, we should stay away from that. But a lateral split squat, if it's a lateral deadlift, it's most likely going to play in our favor. So for the most part, I would say 7 or 8 out of 10 times, the lateral split squat is another great solution for people with knee pain. Now, let us go into more exercises. So if you think about this, we're trying to control where the motion of the knee is. So in a split squat position, that knee angle is going to stay the same constantly. So if we go off of that logic, things like glute bridges would be great. Things like hip thrusts, single leg hip thrusts, hamstring curls, all those things tend to be the better option. I'm going to go back to just me here. So we have glute bridges, single leg glute bridges, feet elevated glute bridges, single leg feet elevated glute bridges. We have hip thrusts, single leg hip thrusts, barbell glute bridge, barbell hip thrusts, single leg barbell glute bridge, single leg hip thrusts. And now you can kind of see like all those exercises don't require a lot of, movement at the knee. It kind of like literally like you can have your knee angle at 90 degrees the entire time. And when the knee becomes aggravated, it's when that knee joint has to move under load. So all those exercises, like I gave you a long list of stuff that you can do, which will help in the long run. So now we have all these different options. And now imagine if you're an individual that has been struggling with on and off knee pain, implementing these instead of the exercises that you're doing right now is most likely going to lead you in the right direction. So this is the thing that I love doing, is like working with the individual that has been training for a while or off and on, but has a lot of experience, and they get into these like pockets of their journey where they're just not progressing, something hurts, and it's like, okay, let's identify the issue. Let's figure out why it's causing you pain, and let's figure out exercises that are going to not aggravate it anymore. So now imagine you taking your entire program, I deconstruct it and throw in exercises that are not going to bug your knee. You're going to see huge gains. And that's what I do. And this is what my book is about too, because you're going to do an assessment. And that's my biggest thing, is that I need to assess where you're at. I need to see how you move. I need to see what joint is doing what. So now I can be able to distinguish what exercise might cause irritation at the knee joint, and now throw in exercises that won't. And that's where people will see huge changes. So I'm going to leave it there because I feel like I've been talking forever, but I think that's going to give you a lot of clarity on where, you should go when it comes to knee pain, knee friendly exercise and things like that, and kind of put you in the right direction. So I'm gonna leave it there. 100% hit the show notes to watch this episode. Subscribe to my YouTube channel, put your name down for my ebook pre-sale list. So in January, when I release the official date for it, I'm going to email every single person on my pre-sale list and let them know that here's the link that you can use before anyone else on the internet, and you're going to get yourself a copy. I'm literally just putting the finishing touches on my book. It is so freaking good. Over 100,000 words. This thing is going to be a monster. You're going to have a program to follow, an assessment to do that will dictate what you're going to do in the program, full-on Kinstretch workouts where you get to follow along with me like I'm actually coaching you, a lot of anatomy that you're going to learn, and not like boring stuff. Like I use my humor a lot when I teach anatomy, and it's going to shed some light on why certain things feel a certain way or why you're doing a certain exercise. And I go into all my training methodologies, and there's just a lot. And later today, actually, I'm going to be posting the full-on index of my book online. So keep an eye out on that. So you 100% want to put your name on that pre-sale list, because this book is the best work I've ever put out in my entire career. And I am excited to share it with you guys. So I'm going to end it there. Thank you so much for listening. Till next time.